and she is gonna speak about relationship between bone and breast cancer. This systematic review of lectures. Okay, you may go on. Kindly, if you please be seated. خلود معلش نشوف الخميسه ونكمل. غدا معاك وبعدين دي مراتها يا صاحبي. مش جاحد ده حبيبي روتين يعني. بالراحه عليها اي حد هيكلمها. We are very sorry for this interruption, but I promise you it will be worth your waiting for.
It's a new guy, so. Asma Sisi, I'm in my last year of specialty on obstetrics and gynecology in the Free University of Brussels, Belgium. Thank you to give me the chance to present my work. It's a systematic review of literature concerning the relationship between bone density and breast cancer risk. We know that the risk of breast cancer is influenced by the estrogenic climate. Many arguments plead for increasing risk of breast cancer associated with the prolonged exposure to estrogens, such as early menopause, early menarche, late menopause, and late age at first pregnancy. Bone mineral density can be considered as a marker of lifetime exposure to estrogen. We know that, in fact, bone contains estrogen receptor and is sensitive for the circulating estrogen, and we assist in the 10 years of menopause to a more important decrease of bone mass. We can suppose that bone mineral density can reflect the risk of breast cancer. The objective of my study is to evaluate through systematic review of literature the relation between bone density and the risk of breast cancer. I've searched in the literature up to September 2012 the association of the following keywords: breast cancer, breast disease, bone density, bone mass, osteoporosis, bone fracture, estrogen receptor, breast cancer mortality, and breast cancer risk factors. I've excluded studies evaluating bone mineral density or fracture in breast cancer patients using adjuvant or neoadjuvant therapy. I've made a descriptive analysis of the articles according to their level of evidence and the measured outcomes. I found 23 observational studies of evidence of level of evidence 2 and 3. Here I present the case control studies. 8 case control studies, the number of cases, the age of patients, and the skeletal evaluated zone. And here the prospective studies, I have 14 studies. I'll present these studies through the different items evaluated. The first item concerned the relationship between bone mineral density and breast cancer risk in perimenopause or early menopause. 2 prospective studies have evaluated this issue and doesn't found any correlation between bone mineral density and the incidence of breast cancer. The second point evaluated the relationship between bone density and breast cancer in late menopause. 12 studies out of 14 found that women with the highest bone densities had significantly increasing risk of breast cancer. I present this study. Here is a forest diagram presenting the studies and the associated breast cancer risk, and we see that the majority of studies found a positive, significant increasing risk of breast cancer associated with higher bone mineral densities. The combined risk is estimated to 2.13 fold increase in breast cancer risk. The third point evaluated bone density and expression of hormone receptors. One study out of 3 found that bone mineral density among women whose tumor expressed estrogen receptor were significantly higher than those of healthy control subjects. The fourth point evaluates the relationship between bone density and tumor stage. 3 studies out of 4 found that women with the highest bone mineral densities had increased risk of breast cancer, especially at advanced stage. The fourth point evaluated the relationship between the past of bone fracture, osteoporosis, and breast cancer risk. 4 studies out of 7 found lower breast cancer risk in women with previous fracture. The 6th point evaluated bone densities and breast cancer mortality. One prospective study have evaluated this issue and found that women with a high hip breast bone density have 3 times higher breast cancer mortality. The 7th point evaluate the bone density, the relationship between bone density, breast density, and the risk of breast cancer. One study evaluated this issue and doesn't found correlation between breast density and bone density density was not associated with high bone density was not associated to the increased risk of breast cancer. The 8th point evaluated the relationship between bone density and Gale score. One study evaluated this issue and found that the contribution of bone mineral density to predict the incident postmenopausal breast cancer is independent of Gale score. I conclude through this systematic review that high bone mineral density in postmenopausal women may be considered as a risk factor for breast cancer. This may be due to lifestyle factors that influence by the same way or differently the breast and the bone, genetic factors, sexual hormones, growth factors, and pro-inflammatory disease, pro-inflammatory cytokines. The way these factors interact can explain the variability of results that I've noticed in this study. That's all, thank you. And here is the poster presented outside.
Okay. Thank you very much for this elegant. We have to. You can answer because of the prayers. I'm sorry for that. We thank you very much, and we finishing this session.